one of the amazing things about healthcare is that 40% of Medicare, which is this enormous pot of money now, is spent in the last 6 months of life. So is that a discussion worth having with your parents? My father actually was killed in a head-on crash. Probably a number of you have that experience with one of your parents, or both of your parents. And the only good thing to be said about that, if there's anything good to be said about it, it's quick. And I was talking to Corey Palumbo, and I said, I went down to the coroner's office because I wanted to somehow reach peace within myself about his death. And it was very sudden, you know, his hit head on, coming around the corner. And I looked at a picture of us. I wanted to see a picture of him. And I did, and his face was completely peaceful. He was leaned back against the seat. There was no blood. He was very calm. He wasn't living. But it was calm and peaceful. Not so with my mother. Not so with my mother. That was 12 years of absolute agony for her, for all of her children, for so many of her friends. It's not fair. It is not fair that people have to spend so many years really becoming nothing in terms of their mental capacity. That people have to spend so many years really becoming nothing in terms of their mental capacity, but still being kept alive. And that's why in all of this debate about healthcare, and so many of these people who broke up healthcare meetings, you talk about end-of-life care, and people who start screaming, yelling at you, talk about granny killers. Well, don't try that one on me. Don't try that one on me. I didn't want to see my mother suffer. I didn't want to see my mother be kept alive when the Hippocratic Oath says nothing about curing people. It says, do no harm. And they were doing harm to her. You know, you've got to fight for Medicare in healthcare. It isn't just a question of healthcare that you do get, it's a question of the healthcare you might not get. Because in 2017, which is, 8 years off, in healthcare, that's your father knows this, you know this. 8 years is like 2 weeks. And the Medicare trust fund is just going to start disappearing. And so one of the amazing things about healthcare is that 40% of Medicare, which is this enormous pot of money now, is spent in the last 6 months of life. So is that a discussion worth having with your parents? Should your minister or your physician, your primary care physician, be allowed to discuss with your parent or us or me or Sharon what if something were to happen? What would your wishes be? What would your wishes be? What about your children? Don't they have a say? Well, right now they do. But in our case, there are 4 children. If one child disagrees, then the other children's views don't make any difference. We haven't thought about this stuff. And people start screaming when you talk about it because they think you're killing Granny. Well, it may just be that you're trying to pay your respects and show your love to Granny. And in the meantime, allowing Medicare the money to exist. And in the meantime, allowing Medicare the money to exist for a number of years to come. We passed the Children's Health Insurance Program. And that should be so easy. It affected 11 million people. 11 million kids. A kid in America is from 0 to the end of 18. And if you're really young, you really need health care. You need early screening. You need to be tested. You need to have all kinds of shots. You need to have all kinds of shots. You need to have all kinds of shots. Because they can tell so much more now about what you're likely to face if they can get you when you're young. And just because you're 16 or 18 doesn't mean that you're going to avoid some kind of a healthcare crisis. So the president signed that. We passed it twice. President Bush vetoed it twice. Surprise. So then in comes Obama, we passed it again, and he signs it. And I was really happy about that. I really worked hard on that.